A very good afternoon to everyone. This is Bahachait here from Prime Health Pages. We are live from our Twitter, LinkedIn, YouTube, and Facebook pages. A very important webinar that we are here with. Uh, Talking about men's health, we have seen previously in October, which is dedicated to women, and we've got a very special day here today, which we have dedicated to men's health, because men's health is equally important as of women. So we're going to talk about some very special, or very, I should say, important, or I should also say that dangerous disease that is there. Of course, we're talking about the prostate cancer today here. So just let me just tell you something about it. Before we move on to the topic, I would like to introduce my speaker of today, consultant urologist, Dr. Vipul Agarwal. Doctor, thank you very much for joining us today here.
Thank you, Fahad. Thank you for inviting me.
Dr. Vipul has an extensive experience of more than 12 years, out of which for the past 8 years he's been practicing in UAE, and his expertise, of course, are in urination issues related to men's health. Specifically, when you talk about urology, you also have in your mind stone-related issues, and of course, and the list goes on. But today, specifically, as I said earlier, when you talk about men's health, November, we call it, we are specifically dedicating this webinar to prostate cancer, which is a topic that needs to be known. The information has to be spread out by everyone, and that's where the healthcare prime health, I should say, with personalized care, we come in and we are here with the webinar to introduce or to talk about the prostate cancer. Now, prostate cancer begins with cells in the prostate gland, that start to grow out of control. The prostate is a gland found only in males. And it makes some of the fluid that is part of semen also. So Dr. Vipul is here to talk about the whole in detail. We'll be taking some questions from the audience. So I would request you, before I start the webinar, to please put in your questions in the comment section if you're watching from any of the channels, and we will be asking those questions to the doctor directly. Dr. Vipul, once again, thank you very much. As I said earlier, that prostate cancer, which is really very important to discuss and to understand and let people know about it, because a lot of people are not having regular checkups on this. So, doctor, my first question that I would really look into is, doctor, what actually is prostate? Because a lot of people, let's say a layman, a normal person, would not know about this cancer. So what is actually prostate, doctor?
Yeah, Fahad. See, first of all, I'd like to thank you for inviting me on this very sensitive and a very important topic. We are celebrating men's health, so becomes all the more relevant in this context. Prostate is a natural gland. It's found only in males, and if you do an ultrasound, it will be in everybody. It's about a walnut-sized gland in the urine passage between the bladder, which stores the urine, and on its way out through a thin pipe called the urethra. So it's in all males, and it shows certain age-related changes. Its main function is to contribute to the men's secretion, which are used, or the semen, which I can say, which is, it contributes to the sperm's maturation in the semen so that it can fertilize the woman. Conception can be produced.
Great. So that's the part of the prostate in men, actually. So
Yeah.
that's an important part of the body. And doctor, let's talk about the cancer of the prostate. What is that?
See, a cancer by itself of any place is when in our body everything has a controlled growth and death. We have parts which grow and we have parts with age and die. So the body has a very nicely balanced and controlled mechanism to see this growth and the death in the part of body. Now, cancer anywhere is when the growth becomes uncontrolled, it spreads beyond a limit, and it passes or affects the functioning of that particular organ or other organs. So prostate cancer is when a cancer happens in the prostate, it will grow in size to a level where it is not being controlled. It will press other adjoining structures like the urine pipe, the bladder. It may spread out to other organs, like it may most commonly spread to the bones, where it can make the bones weak, lead to problems of bones. It can spread to lungs. Occasionally, it may spread to brain also. So, prostate cancer is uncontrolled growth of prostate, which is not being controlled by the body.
Great, understood. Since doctor, this prostate cancer is only in men, what are the risk factors, doctor, for prostate cancer?
See, the most important risk factor for cancer of prostate is a family history. So, if somebody in your family has had a prostate cancer diagnosed and hopefully treated, the chances increase. And the more the number of relatives, so like direct relatives, like if father, brother, they have prostate cancer, the chances of having a prostate cancer in the person is much more than a normal person. That being said, a very common misconception is other illnesses of prostate, which are misinterpreted by patients as my father has prostate problems. Now, all prostate problems may not be cancer. So, specifically, only happening of prostate cancer in the relatives has a high risk, not all problems of prostate. Another risk factor is the ethnicity. There are certain ethnicity origins which have more risk of cancers and more aggressive form of cancers, like Africans have more aggressive and more chances of having cancers. Most common and proven are these two risk factors, though of course a good health will decrease the chances of cancer. Smoking, a very common cause for other cancers, has been shown to increase the risk, but there is no direct cause effect proven relationship as of now. So I don't say smoke, I say stop smoking, though it is not a direct link to prostate cancer.
Right, right. So, doctor, why you just mentioned that Africans are more prone to prostate cancer? Is there a specific reason for that, or no, or it's only them and the others not?
See, probably there is some things in the genetic material. Also, some tissue level factors are there. Some of which we have been able to researchers and scientists have been able to evaluate. Some of which are still being done, but the bottom line or the final result is yes, these people are more prone and have a more aggressive form of cancer. So screening, evaluation, checkup, and treatment should be a bit more aggressive on these. But that doesn't make other people being careless. Ki, okay, I am not at risk, so I
Yeah.
should not be taking care. I should be careless. Anybody has a risk of getting this problem, and everybody should be taking care of this health and not taking it lightly or carelessly.
Right. Doctor, what about people who say that the prostate is enlarged? Are they more prone to the cancer or having it?
That's actually a very commonly asked and a very relevant question. See, prostate has certain age-related changes. Like I have whitening of hair, graying of hair. So prostate enlargement is an age-related change. Now, the only thing common between a prostate cancer and prostate enlargement is they both are in the prostate itself. And because prostate cancer also increases in size of the prostate, so some of the problems patient has may be similar, the symptoms that he may come. But there is very less likely chance that if somebody is having a prostate enlargement, it will progress into prostate cancer, irrespective of whether he takes a timely treatment or he neglects. So a prostate enlargement doesn't evolve or complicate into prostate cancer. There are a lot of patients who don't have prostate enlargement, still may have cancer, and vice versa also. So they are two separate entities, not related in a chronological order to each other. And the only common thing is both are in prostate.
But doctor, this prostate enlargement, is it common in people, or it grows with the passage of time, or there's any specific reason of enlargement?
Yeah, this actually, people ask this very frequently. The answer is aging common? Yes, everybody will age because
That's
prostate
correct.
enlargement is a age-related change in the body. So everybody will
Okay.
age. Some feel aged at an earlier age, some feel aged at a later age. So
Correct.
everybody will have prostate enlargement, not cancer. The non-cancerous enlargement, I would say, to be more specific and clear. So everybody will have it at a certain point of time. Some have it at 40, some 50, some 60. But yes, it is going to be there. It may be troublesome, it may not, but yes, it is going to be with everybody because it's an age-related change. It's not a disease.
So I think you've answered. I was going to ask you that can it be prevented? So maybe the answer is no. Is it?
See, enlargement can never be prevented. The only thing is timely evaluation and checkup can detect it at a very early state of. I'm talking about the enlargement first. Timely
Yeah.
detection can detect it. A checkup can detect it at an early age, and sometimes lifestyle changes in your uh, exercise may avoid the need for medicines or for surgery, or if it's a bit more, some timely medications may avoid the need for surgery, but there is no way you can prevent prostate enlargement. Now coming to the topic of the day, prostate cancer, same thing is there because we don't have any control or any option on our ethnicity. We don't have any control or any option on our family history. So which are the two most common and directly related risk factors for prostate cancer? So to say that there is something, some method, some diet, some lifestyle which can avoid prostate cancer is an absolutely wrong thing. The best way to do that is to keep a regular checkup because detected early, it can be treated in a very, very efficient manner, and the patient can lead a normal lifestyle like a normal person when it's timely treated and diagnosed and treated. So, early detection and timely treatment is the key rather than trying to prevent it.
But doctor, as you said that regular checkups are very important. I was going to ask you this. Uh, what is the time frame of that regular checkup that we should be coming to the doctor every now and then?
See, if you have a family history of somebody who's been unfortunately suffering from prostate cancer, then you should start really early, probably say around in your mid 40s, and then you should get yourself evaluated and do regular screening. However, even if you are not having any family history, you should have a regular screening and evaluation for early detection. Now, the ideal time frame is at least once a year you should visit a urologist, get yourself examined, some blood tests, some ultrasound, sort of a screening program for your prostate cancer. And if it is normal, once a year should be a sufficient period to see if there is anything which needs an
All
early
right. So
detection.
yeah. That's very clear. Thank you very much for that information, doctor. Uh, doctor, how do I know if I have prostate cancer or the chances of the prostate cancer? Well, we've talked about the how we can develop it, but how do we know that we do have chances, or if I do have it?
See, family history, if it is there, if you are in that ethnic origin, you do need to be on an early screening schedule. But prostate cancer is one of the very deceptive form of cancers where I have seen in my 12 years of practice, and I would agree most of the urologists, patients can come with no problems at all coming out of routine screening with a bad
Mhm.
cancer inside. There
Oh
are
my God.
patients who are massively spread out and no problem at all just out of routine health checkup. And there may be patients with initial troubles because of prostate enlargement and on detection. So there is no clear cut universal sign that if I have this problem, then only I will have a cancer. There may
Yeah.
be problems at all, and you might find yourself diagnosed on a routine health checkup, or you may have symptoms like problems in passing urine, or problems of constipation, blood and stool, back pain, bone pain, which are signs of spread out of cancer. So the point is, minor symptoms also should not be taken lightly, and ideally, you should get yourself evaluated even if you don't have any symptoms.
Right, thank you. Doctor, you've already mentioned about screening. Now, screening, when I say what I've understood from you is that coming to the doctor regularly. Is there any other way of screening apart from going to the doctor or going to the doctor? What are the screening possibilities that we're doing?
When you enroll yourself for a prostate cancer screening visit, the visit to doctor is essential because certain examination, like the examination of the prostate by per rectal examination, the doctor feels the prostate. He will examine the prostate and touch and feel it to see if he can feel some abnormality, some abnormal texture, abnormal size, abnormal nodule. So, though blood tests are available for screening, but they are not an absolute yes. A doctor evaluation and examination is a must to see the screening and evaluation for prostate. And also, the blood tests are to be interpreted in the light of the patient history. So, if you go for a blood test and it comes out, you need to see in the context of patient's overall problems to interpret whether it's a scary thing or it's within normal limits. So when you come for a hospital screening, the doctor takes a history, checks for any symptoms which may be an indication, does an examination, and advises some urine test, blood test, and ultrasounds to see for the prostate cancer.
Right, doctor. I want to know, most of the time, as we've also discussed that, as you said, that after 40 onwards or 45, you should have a regular screening or checkups with the doctor. Is there any case ever in the history happened to any men, identified with the prostate cancer earlier than this age?
Yes, there may have been exceptions, but then those are usually I think remember seeing a few patients in their mid 40s or late 40s, but then those had a very, very strong family history of cancer, like maybe 2 or more relatives were there. But as such, a patient with no family history and no major risk factor like ethnicity, a patient having prostate cancer in 40s is less likely. But yes, that I said, that should not make you lax or careless, because there are patients who can develop even without family history. So it is better to get a regular screening and a checkup.
Doctor, what is PSA and how accurate is it for prostate cancer?
Yeah, so PSA is a blood test which checks for a chemical which is secreted from the prostate. Now, the normal value is 4, and some literature take it as 2.5. Now, PSA is the primary blood test as a screening tool for prostate cancer. But then, like I said, a doctor will always interpret the reports in the light of the patient's other clinical conditions. So it is increased in cancer, but it is not increased only in cancer. And I have seen, last week I saw a patient who was admitted earlier with a PSA of 180, which is scary, because if 4 is normal, it is more than almost 50 times. But then he had severe infection of prostate, and with treatment, as his prostate improved, his PSA came down to almost 5. So PSA is an important part of the screening tool for prostate cancer, and it is a very vital part. But we should remember, because sometimes I do get patients, doctor, my PSA is 7, my PSA is 10, my PSA is 15. That doesn't label him as a prostate cancer patient. That is where you should see the history, the patient having any history of recent urinary infections, even in elderly, like to the patients of age around 60, and overnight contact with wife, sex can increase PSA levels. So these things are to be taken into account when we are doing it. Yes, but PSA is definitely a primary screening tool for prostate cancer. It's a blood test. It's not, and you don't need fasting for it. It's not like I need to have some or anything. You walk in any time in my clinic, I examine you, I advise a PSA, you can immediately give the blood sample and follow up with the reports.
Great. Doctor, does work ethics also have a situation for prostate cancer? Now, why I'm asking is this, you can see the question on your screen by Ms. Sahara, and she said, hi, is there a correlation between sitting for a prolonged hours and PPH? For example, will people in the transport profession, like taxi drivers, are at higher risk?
See, this question is for DPS, but like I'll take it head on. See, there is no direct relation between sitting for prolonged hours and prostate. The only thing is, if your work style is sitting prolonged hours, it's not an overall healthy style. You should be active. You should do regular exercise. Sitting as such on a chair, whether it's on driving seat or on office chair, is not a healthy way of lifestyle. And if you're sitting for long, especially these taxi drivers, they're in too much of a rush, they tend to hold urine. So it does not have a direct bearing on the occurrence or the problems of prostate, but it will raise wrong habits in your urinary bladder to hold urine when you should be able to pass urine. So these may create urinary problems, not as a direct causing prostate related problems, but as a way of affecting the bladder. Directly,
Right.
they don't have a positive effect, but it is not recommended. You should follow a healthy lifestyle and be active in your job, not just sit.
Great. Great. Thank you. Thank you very much, doctor. You've answered that, because I was going to ask you a similar question, but you've already answered related to the urine. Doctor, what are the treatment options when we are diagnosed with prostate cancer?
See,
I want you to split it up in early detection treatments and later, end
see,
stage also.
the treatment is not according to the early detection and late detection. I would
Uh-huh.
reclassify it is to patient wise. Now, if
Okay.
I have a patient who's 80-year-old, active otherwise, but in house, retired and all, if I find him having a prostate cancer, I will not be very aggressive. And if he's not having any dangerous complications like bone fracture or anything, I might just keep a watch on him. It's called active surveillance or a watchful waiting. Similarly, if I have a patient who is a very young patient, he will need an aggressive treatment. So there are options like I can have watchful waiting, where I just keep a watch to see if any complications develop and treat, because the life expectancy of the patient is accordingly. So if I'm expecting a patient to live more than 10 years of healthy lifestyle, I might be more aggressive. And then there are, because with screening, certain cancers come up at a very, very early stage, which may not be a potential troublemaker in the future. Because if you are screening, you are trying to catch it real early, which is good. But then you might find some cancers which may not become a health issue even 15 years down. So in those cases, the treatment option is called active surveillance, in which you regularly keep check on the cancer, don't treat it, but the moment you find it becoming a potential trouble, you step up the accelerator and be aggressive on the treatment. So these are the non-medical forms of treatment like watchful waiting and active surveillance according to the stage and the expectancy. Apart from that, if the prostate cancer has not spread, we have the option of radical prostatectomy, which is a surgery, robotic assisted radical prostatectomy, which is a very effective and a very timely proven treatment modality in which we remove the entire prostate, and that's the end of it. For different stages, then we have radiotherapy, in which we can give X-ray radiations to kill the prostate cancers. And with technology, it has become so advanced that you can specifically focus to the cellular level which cell to focus and which cell to not to focus. And because prostate is controlled with hormones, some hormones are helping prostate grow. So medications in the form of hormonal therapy are also helpful in patients whom we cannot operate, because either they are too weak to get surgery or it's spread out. So androgen therapy, and then of course chemotherapy. So we have a whole gamut of options according to the stage, patient's fitness, and life expectancy.
Doctor, do we have these treatments that you mentioned at the end in Prime Hospital?
We do not have right now, but we are coming up with the state-of-the-art hospital, which will hopefully have all the treatments for prostate cancer.
Great, great. So, okay, great. Thank you very much. And doctor, we've spoken about the prostate cancer. We've spoken about the symptoms. We've spoken about the treatments. Now, once the treatment is done, we've heard all forms of cancers have some side effects or later on in the life. So I just wanted to ask you, what is the life after diagnosis and treatment of cancer patients?
Yeah, that is actually a very important question, because once anybody is diagnosed, when he's considering the treatment options, he wants to understand the outcomes and what will be my lifestyle. So
Correct.
depending on the treatment, like the options I advise, most of the patients can lead a very healthy lifestyle, including a very active sexual life also. Of course, that depends on the grade of prostate cancer and how severe it was and what kind of treatment was required. But I have seen in my clinical experiences patients with cancer spread out to multiple parts of the body and still living normal life for 10 years after diagnosis. So to say it's the end of the day and it's doom is wrong. Timely treated and properly treated, most of the patients can lead a normal, healthy lifestyle after prostate cancer. Any form of treatment that we do.
Doctor, is there any weakness, or you say, yeah, I should say, the weakening of the urinary part or bladder once prostate? Because I know a person who's probably aged, like you can say maybe 60 plus, and I've seen him now wearing diapers because he was having a prostate cancer, but now because of the treatment that they have taken, maybe it's a chemotherapy, the veins, I should say, the bladder, the pipes, that they are weakened. So what is that?
Yes. Yeah. See, so if you're removing the prostate cancer by surgery, you need to join the urine pipe and the bladder together. So
Uh-huh.
that can sometimes lead to issues like narrowing of the urine new junction. Sometimes leaks can be there. More
Leaks,
so
yeah.
when you're giving radiotherapy. Now we are in an age when we can give target the cells that we are giving radiotherapy, but still, if you are giving radiotherapy, there will be some exposure to the adjoining structures, one of which is bladder. So those changes can lead to urgency, urgent incontinence, overflow, all these things. You might need diapers for some time initially and sometimes for longer duration. And yes, the things may not go as nicely as planned, and there can be issues, but I would say that might be a bit more unfortunate. But because with the advancement in the techniques of surgery and radiotherapy and cancer therapies, these chances are less, but yes, they are. And of course, prostate, saying all said and done, it's a cancer, it can come back, and despite all efforts, if it comes back, then the safer treatment options are going out of the window. Then you need to go to level 2 treatment, which again becomes a bit more heavy on the body, and then the side effects of chemotherapy and all may come up. So you might, though not wanting, have to face them.
That's correct, doctor. Thank you, doctor. I've got a couple of questions I would like to, put this in front. Now, Mr. Mohammed Nias has asked, what about robotic-assisted radical prostatectomy? I think he's asking if this is one of the treatments that we are looking forward to for prostate cancer.
See, the robotic radical prostatectomy, first of all, is the surgical treatment for prostate, and presently it is the state-of-the-art standard treatment, provided the cancer can be operated, or the operation or
Right.
surgery is the indicated and best option considering the stage of the cancer. It's not a
Correct.
universal answer to all cancer stages, but once evaluated and found that cancer surgery is the ideal treatment, then robotic assisted radical prostatectomy is best. Now, in robotic assisted radical prostatectomy, the operation is done by a surgeon himself. It's not like I'm sitting in my clinic and some robot is operating in the operation theater. The only thing is the ancillaries, the modes, the surgical instruments are a bit more robotic. So my access to difficult positions and structures becomes more accurate. My surgery becomes more accurate. My dissection and saving the safe tissue and removing the bad tissue becomes a bit more accurate. So robotic radical prostatectomy has increased the precision of the surgery and decreased the side effects of surgery with the use of machines. That's how
Correct.
it works.
Okay, right. Thank you very much, doctor. I've got a question from Mr. Maqsood, and he's saying, what if you have pain in testicles? Maybe he's relating it to considering it maybe a symptom of prostate cancer.
See, a prostate cancer directly will never cause pain in the testicles because it doesn't spread along that route. But any prostatic enlargement, whether it's cancer related or age related, can cause infections which may go to the bladder and may go to the testicles also. So testicular pain can be occasionally because of infection of the prostate or prostatitis, which may be in young men and in older men because of prostate enlargement or prostate cancer. So though not directly related, but there can be an indirect relation between these two.
Right. Thank you. There's another question from Mr. Muhammad Niaz. How many times take solve urinary incontinence?
How much time does it take to resolve urinary?
Maybe that's how he wants to
So urinary incontinence is a very broad term. It can be multiple kinds of urinary incontinence. Not talking about a prostate cancer treatment, if it's a surgical treatment, if the prostate cancer is really enlarged and you are not able to completely take it out without harming the sphincter of the urethra, it may take quite a time. And there is another form of urinary incontinence, which is overflow or urgency incontinence, which happens after radiotherapy. So most of these usually resolve with time, but certain ones may persist and might require medications. So it's a very broad term to comment, but yes, it varies according to the cause, and it's usually treatable if it doesn't resolve by itself.
Great. Thank you very much for this information, Doctor. Doctor, we've spoken about a lot about prostate cancer. As we are also moving towards the end of the session for prostate cancer, I really want you to, give us some final comments that would you like to give to people who are listening to you at the moment.
See, so my point is that a lot of patients are hesitant, not only cancer, but a lot of other illnesses. They are hesitant that if I go to the doctor, he will diagnose and treat me for some disease. Now, the doctor never puts the disease in you. The disease is already in your body. Yeah. And running away from a problem is not going to solve it.
Oh, correct.
So if you are having a doubt, if you are having the risk, if you are having the susceptibility, if you are having concerns, visit a doctor. I'm pretty sure none of the doctors will put a false report or create a disease in you. It's your body that they will check. So if there is some problems in your report, it's the patient's body which is you're just trying to detect it. And if you go early, you might treat early. If you go late, you might, we call it stitching time saves 9. So never be hesitant that if I go to the doctor, I might need some tests or I might need some treatment or I might get disease. No doctor is going to create a disease. The only thing is going early will save you from unnecessary complications, sometimes even treatment. If it's a early stage, I might say, okay, it's not troublesome, let's do a wait and watch. So every visit to the doctor doesn't mean you come out with a disease, you come out with a treatment and you come out with something major. Go to the doctor, get yourself timely screened, get yourself evaluated. Many of the patients come to me with concerns, we evaluate, and everything is normal, they are relieved. When they initially visited, they are very concerned, they are in panic mode. So many of the problems, that the moment you do the test and are assured that they are normal, they vanish. So visiting the doctor may not only treat you medically, but also by your concerns, and your stress may be relieved if he finds everything is normal. So don't hesitate, visit a doctor, get yourself evaluated, get yourself screened. If it is not there, enjoy your life. If it is there, get a timely treatment.
Great, sir. Thank you. Thank you so very much, Doctor. This was wonderfully explained, especially the final message where, you've summarized the whole webinar, that we really need to get ourselves checked, especially when we go above 40, and a timely screening can definitely save a lot if you're diagnosed with prostate cancer. So thank you very much, Doctor, for the information. I would like to tell my audience here that Dr. Vipul Agrawal, once again, is consultant urologist who's currently practicing in Prime Hospital with an extensive experience of 12 years. You can see the numbers for booking an appointment with the doctor at the bottom of the screen. You can always send a WhatsApp or book an appointment through our Prime Health ME application. You will find the doctor's name and you can always book for him. Prime Hospital is in Al Garhood, and you can always visit the doctor for your treatment. Not only talking about prostate cancer, as I said earlier, his expertise as a urologist is absolutely vast, and we've mentioned a few of them. You can also find his profile and details on our website, which is primehealth. .ae, and you can always visit there and see the details. Thank you very much, doctor, for all the information. I just can see one question here. Okay, so we've got a question which is actually not related to the topic, so I would request the concerned person that we will definitely ask this in an upcoming session. So thank you very much for watching us at the moment. Please do give your feedback to us, do comment, and do share the videos with others, because it's every individual's responsibility to tell the next person about, especially a disease like cancer, so that people get the knowledge and they would visit the doctors and get themselves checked. Thank you very much. We'll see you in another webinar. As Prime is all about personalized care personally, this is what we will deliver and we are delivering. Thank you.
Thank you.